The following segment is sponsored by Northern Nevada Health System.
We're here with Dr. Michael Moore, a neurosurgeon with the Sierra Neurosurgery Group. Good to see you, doctor.
Thank you for having me.
Thank you. It's cold out there. We're going to talk about some of the winter issues when it comes to spinal injuries and head injuries during the winter season. What are you seeing?
So we see a big uptick in both head trauma, so people with slip and falls where they fall down and they'll hit their head. And we'll also see compression fractures is very common. A lot of times what people will do is they'll see a wet spot or they think it's a wet spot in the morning and then they'll slip on it taking out the garbage cans or walking their dog and they'll fall right onto their bottom and they'll get a compression fracture. They can be pretty severe or they can be pretty minor, but in the elderly that tends to cause a lot of trouble with mobility and independence.
And so how do you know if you need to come see a doctor or go to the ER when you've slipped and fell?
I think if you have a severe pain or there's a loss of consciousness, those are two really good indicators to go to the ER.
Got it. Yeah. When should someone seek care? I mean, other than knowing, oh, I fell, should they talk about it? Or if it's a nagging pain, that kind of thing, or if the pain goes away?
So sometimes we'll see somebody, they'll have an initial fall and then they'll have a delayed presentation. Often it's because the pain increases. And that's common. If you get bruised, the pain increases over the next 4 or 5 days.
Got it. And how can someone avoid serious head or spinal injuries during the winter months? I mean, we still want to be active even though it's cold out there.
Yep. So what I tell my older folks that have either had a slip and fall or if they're totally unrelated, I'm seeing them for degenerative changes and I just see them as part of kind of like a public service announcement. I always tell them, don't walk on anything that looks wet in the winter. So you go out in the morning, you think it's wet, but it's actually ice. And then they'll see these people, their feet will kick out from underneath them and then they have a fall. So avoid anything that looks wet. If they have a north-facing driveway, I usually tell them to actually go and get little cleats. They have something called Yak Trax. It's a pretty common brand. I just pull it up on my on a URL on my computer. I show it to them. They're about $20. And so $20 is cheaper than a hip or a back surgery.
Yeah, so, or recovery time and all the pain, for sure.
Yes, of course.
Dr. Moore, appreciate your time. Really appreciate it.
Thank you.
And for more information on all of this, just go to our website, mynews4.com.